Good afternoon. Thank you, Governor. Thank you for those updates. Thank you for your leadership, as always. I also want to extend appreciation to our fantastic congressional delegation and to relay appreciation also to our local business owners. We know that the economic health relates directly to the public's health as well. Thank you for your tremendous patience and partnership. So to start with giving you a quick overview of the numbers, as the governor said, we have 8 new cases of COVID-19 in Rhode Island, 132 total. 5 of these 8 new cases are males and 3 are females. They range in age from their 30s to their 60s. While it's important to understand that the data numbers each day will ebb and flow, they'll be up or they'll be down, the key is everyone implementing these community mitigation directives that we are giving. The better that we as Rhode Islanders can do, staying at home, only going out for essential needs, when those essential needs are addressed and we're going to supermarkets or other places, social distancing is being used, frequent hand washing and hand sanitizer gel is being used, and seniors, people with underlying health conditions, and particularly those who are sick with symptoms are not going out. If you know a senior, if you know someone with underlying health conditions, go to the grocery store for them. Let's all contribute to doing this together. It's with time that we will see the positive impact of these changes as well as the others that we are focused on doing, increasing contact tracing and continuing to identify cases. This is how we as Rhode Islanders together need to be able to address this. Something else I want to address briefly is the issue of elective surgeries. We have received a lot of questions about elective surgeries, both because they require the use of personal protective equipment and because they bring additional patients and people into healthcare facilities. Calling a procedure elective does not mean that it is unimportant. The term elective simply means that the procedure was scheduled and planned ahead of time, as opposed to surgery that was done in response to something like a traumatic event, such as a heart attack or a car crash. Many so-called elective procedures are, in fact, semi-urgent and actually need to be done. These can include cancer surgery, complex vascular surgery, pediatric surgery, and others. We certainly want non-essential, non-critical elective procedures to be rescheduled. But we have been thoughtful about having a blank prohibition on all elective surgeries because some of them cannot wait. So we want to make sure that everyone understands Rhode Island is taking a thoughtful and measured approach, working very closely with our hospital leadership about a structure that will work in making sure that we have enough PPE available and in making sure that if we need to use those facilities, we can, while we also help support the people who have important surgeries that they need to have done carefully. So to help structure the approach that we are working closely with hospital leadership to establish, we have asked facilities to send us plans for 2 things. Plans for the conservation of personal protective equipment so that at least a 14-day supply can be maintained at all times, and a plan regarding how the facility will make decisions regarding previously scheduled procedures that are critical to a patient's life and health, with the understanding that all non-critical procedures should be canceled. So we have agreement that there are no non-critical elective procedures that are occurring now in Rhode Island. This will ensure that people get the care they need while helping us keep patients at home, helping make sure that we are conserving personal protective equipment, and helping to ensure that hospitals have the capacity to treat more critically ill patients. Our hospital and other healthcare facility leadership and partners have been tremendous with us in working over this for the last several weeks. We thank them in advance for their work. We're making sure that we are ready as Rhode Islanders together.